Good morning,
Good afternoon.
and good night from wherever or whenever you're watching us. My name is Sandra Rosario, and you're watching our first episode of Navigating Medicine. We're so thankful to have today with us Dr. Sandra Rosario. Just to break the ice, could you tell us a little bit about yourself and what you do in your everyday life?
Yes, first of all, thank you for having me.
Of course.
And you're very welcome. My name is Sandra Rosario. I am a pulmonary medicine specialty, an internal medicine specialist here in Ajatorre, Puerto Rico, Clínica Las Américas, for outpatient clinics.
Well, we're so thankful for having you here. I wanted to ask you, has always been a dream for you, or was this something that from a certain age you started to discover, or like what was your experience for when you just clicked with pulmonary specialties?
Well, the story is very long. I don't know if you have long time for that, so I will try to be the shortest story as possible. I never had in my mind to be a doctor, not
Really?
ever, no. I decided to study, to have early graduation in my high school, and I decided to enter the University of Puerto Rico in the science program. It was a special program. And then I fell in love with chemistry, and fortunately I got great grades for chemistry, so I was very pleased with that, very comfortable, the famous comfort zone. But then I decided that the research was going to be so boring for me because it's going to be between walls and I was not going to socialize, not see everyone. I was not the most social person, but I didn't saw myself that way. And so I decided to give it a chance to dentistry. So I took the DAT, which is the test to go to a dentist, and I passed it with flying colors. But my best friend was studying dentist.
Okay.
And she told me at 1 a.m. one day, I cannot go tomorrow to your house because I'm doing some small tooth and some small teeth. And I said, no, I don't want to do that. I'm so bad at manual things, so I decided, I passed, but I'm not good at that. I will see myself putting my hands in the mouth anymore. So then my mom told me I was going to apply for a master's in chemistry. But my mom told me, give another thing a try, perhaps another thing that is related to dentist, because she thought that I would like dentist because I was in love with that. So I decided to enter to the Puerto Rico Medical Science campus and decided that medicine can be an option, just to give it a try.
Okay.
And I took the ACAD, I passed it, I entered, and I fell in love with it. But in the long run, at the end, I decided to apply to neurologist because I love a lot of intensive care for neurologists, to myasthenia gravis, and some conditions that you have to be hands-on.
Mm-hmm.
The first year, my reviews from my professors were not good. I was not happy. All my friends were very lazy because they were studying neurologists because it was an easy thing to do, and I wanted to be with hands-on. And then I quit neurologist and I kept my track on internal medicine, and I fell in love with my pulmonary fellows and with my pulmonary doctors that were in intensive care, saving lives, and I said, this is the thing I want to do. So my decision came throughout the years.
It evolved. No, is that us as high school students that mainly are the one that are watching us right now, we tend to very question ourselves in which specialty or if this medicine is the right thing for us. But with this story, we can really tell that everything goes in every step. We don't have to rush things because really it's a journey. And well, as Dr. Rosario, she went through a very long process, but look at her right now, and that's amazing. So as you were telling us, you studied in the College of Puerto Rico, the Rio Piedra, and I wanted to ask you, you studied medicine in el recinto de ciencia médica.
Correct. Even though the story is long, it didn't took me that long because I was always like in a rush of things. High school I did it shorter, 1 year less. I did the bachelor's degree in 2 years. I did with a minor in chemistry, and then I entered the School of Medicine. And when I changed from neurologist to internal medicine back again, I was blessed that there was a space for me, so that I didn't waste too much time. So even though the story seemed to be long, it was very short, very short. I was like they told me that I was the mascot, the pet of the, because I was very young at the age that I was doing pulmonology. And it was in the Puerto Rico School of Medicine, everything.
And you don't regret leaving high school a year early?
I don't.
No.
I don't. Casually, last night I was in an event where there were people sharing their stories about how they get to medical school, and it was so broad. There was one that took 7 years to get there because he loved researching physics. There was one that took the same time as I did. There was another one that decided to have a leap year to travel and go back again, and they were accepted anyway to the School of Medicine. But of course, they complied with the requirements. So I don't regret it. Everyone tells me, oh, you lost your senior prom, you lost your graduation from high school. Even the bachelor year I was really very happy. And I felt in the UPR campus like I was just one of them. I was not alone. I really, if I think it backwards now, as you're asking me to go backwards, I really cherish those years, and I think that they were the best years of my life. I don't miss a thing.
Wow, that's
but that depends on the person, really.
No, of course it does. I know people that also skipped one of the years of high school or senior year, and they don't regret it, as you. But we have mainly one of my friends has been interested in it, and the question that he has is that if it's worth it. But with cases like this, we can tell that it can be worth it if it's for you. So
if you're happy, that depends on what are your priorities. If your priorities is to be in a party and don't miss friends, and you see the senior prom and the ring ceremony as a milestone to be reached, which I never saw it as a milestone, then you should stay the whole 4 years.
Well, another question I wanted to ask you is that us as kids, we see medicine as an all-day job, like it's 24/7, and we see it as a job that always keeps you running. And I wanted to ask you, how was your day in and outside of the office? How do you manage your time to have your personal time with your family, with your kid? And when it comes to the office, how do you spare your time for each specific thing?
Well, that depends on the specialty that you choose. So many people decide to study medicine because they want to be rich, which I think that's the worst thing to think, because even though maybe you will get rich, you're going to be mad at yourself because you're going to get very bored and very angry because that's not what you wanted to do with your life. So you will have money, but you're not going to be happy. And that occurs also with the specialties. For example, orthopedics, dermatologists. Now everyone wants to be a dermatologist because there's a lot of money there right now, but as you can see, every corner is doing the thing that they charge you for. So from in your age, when you turn out to be a dermatologist, everyone will do what is giving money, so you are not going to gain so much money. Radiologists also.
Yes.
So many people in my class decided because of what they wanted to do economically, and they don't want to do any on-calls, to be at night waiting for an emergency call and you have to leave your family to attend that. Well, I did not thought about that to choose my specialties. really. I chose it because I love it, and I thought that was enough. In fact, I have a girl, which is one of your best friends. And when she was a baby, I was able to work, and my mom, of course, helped me a lot because sometimes I have to leave her middle of the night to attend an emergency. And I think that in the hospital setting, is much better to deal with the time than in the office setting. Because the office, you have a compromise from one time to another. For example, from 8 to 5, and if the girl needs you, your kid needs you at 2 p.m., you're still booked in the office. But if you go very early in the morning to the hospital, you can see all those patients, and you have all day free until you return perhaps at 6 p.m. again to see what's left. So it's easier to have the hospital, even though the compromise and the type of patient is too much complex. In the hospital, it's easier to come and go versus the office. So I spent my first 20 years going to the office and going to the hospital every day. And then lately, the last few years, I decided to step a little bit more down and settle, because one of my friends go to another practice and the office required my attention, so I make a shift. And now I do it in the mornings until 1 or 2 p.m. and then I get ready to pick up my daughter and I spend the rest of the day with her. So every specialty can give you flexibility. Radiologist, you can do it at your home. You can be in Portugal and you can be working, just as like the influencers, the same thing. Dermatologists, you have to be there, but it takes like 2 or 3 hours a day to gain money there, so you don't have to be that bad. The specialties that really get you a lot of your time and you don't gain that much money is pediatrics. They don't get any money and you have to be there for everyone sick 24/7. Internal medicine, geriatrics, they don't win that much money, and it's a wonderful specialty, but it takes away a lot of time and not a lot of money. But if you love it, you won't care about it.
Yeah.
So I think that with the family and with your sports and with your social status, you see how I changed throughout the years. That depends on your priorities. If your priorities is to make a lot of money, you have to work a lot at the beginning and then step down. If your priorities is just be happy, you can just don't gain that much money and give more time to other issues.
And as you were saying that you worked in the hospital for around 20 years, right? Which environment do you feel like was more for you? Or is it that now that you have like other priorities, you see the office more convenient, but if it was in between the office and the hospital without any other priorities, just you and the passion for the job, what would you prefer?
Well, right now it's obvious that this is the thing that I have to do. But since I'm a pulmonologist with critical care specialty, I think that everyone will rather go to the hospital instead of being in the office.
The cases are very different, right?
Oh yeah, and it's wonderful.
Yes.
Whenever you see that in 2 hours, whatever you did, make a big change in a patient, and you see that he's already with us, and that the blood pressure is okay, and that he's already breathing by himself, and that you did it, and say, yay! Wonderful. Here in the office, you have to take days when they come back with the X-ray, or about 2 weeks, and I say, okay, now I'm better. Perhaps in the hospital you can be more dynamic. It's more interesting.
Wow.
But it's more tiresome.
Yeah, I get that. I wanted to ask, what would you consider the most challenging part of your day when you get to the office and you say, here we go again? Or is it when you see a patient that struggles and you want to give them a care that right now in this moment or in this space with the requirements you can't give them those opportunities? Or
I think it does not have to be with the specialty. It all has to do with the administrative issues. Of course, the health insurance. Of course, if you want to give the best treatment Then they ask you to give a justification why I choosing you that medication. And then you have to write a letter, and it came back in 2 weeks that negative, so the patient is still not treated. And then you have to write a third letter, a fourth letter, and then you have to pick up the phone and call to the chief of the doctor of the health insurance to see, okay, please, I have been asking for this medication and you have not approved it, and it's obvious. Oh yes, it was obvious like 2 months ago. And if you have 30 patients to see every day, to get that time to write all that to like the half of them, then the time is not going to take care of the patient, the time is going to deal with administrative issues. In the United States, since they pay more, they have a physician assistant and they have an administrative assistant, so the physician assistant do half of your work and the administrative assistant do the other work. So that's why there the things go more fluid and you can just dedicate time to see the patient. On the other hand, I rather prefer to evaluate my patient myself and not a physician assistant because I'm not confident with whatever he or she thought the patient is telling me. I have to see her summary and then decide. I don't like that. And of course, the things of the office, the other thing that limits your time and make it a little bit harder. Well, when Luma takes away the electricity, then you have to deal with the planta, and when there is someone sick in the front, and then you have to work as a receptionist. Those things are, but nothing has to do with the practice, with what I studied. Is the thing I'm interested in, because in medicine, at least in my times, maybe your times will be different. We are not trained to deal with that. We're trained to deal with disease or with the patient.
Yeah.
But we are not trained to deal with the administrative part of medicine. Maybe you will be lucky and you will be trained the right way. So you have to learn as you treat patients, and you're not prepared to do it.
So we could say this is more like an all-in-one job. Really, you do a lot of things. You manage everything, and that's very, very difficult. Another thing I wanted to go from is that you said that there was a big difference between what happens here in Puerto Rico and what happens in the United States. And I wanted to ask you, with the colleges and the medicine schools, where would you recommend a student to go to? If you would recommend them to stay here in Puerto Rico, or if they get an opportunity, would you say, I recommend them to go to the United States or to another part of the world?
The question is, if you want to study medicine, right?
Mm-hmm.
Well, that's a big question. The easy answer, and the answer that I give my daughter, is study in a college that you will have good grades. Okay? That is competitive, but you're able to have a good GPA and enough time to be prepared for the MCAT. If you go to Princeton, which you will likely go because you're brilliant, first of all, mommy will get broke. If she doesn't get broke, you will get broke too. You will end up in 4 years with $1 million debt or so. And the competition with the people that go there perhaps will make it difficult for you to shine as you would like to. Recommendation letters that the other doctors will give you to get to School of Medicine. And in addition to that, the grades that you will have, you are brilliant, but maybe there will be a B, perhaps 1C, maybe 3 A's. So your GPA will be perhaps 3.5, 3.4, and here in the UP, you will have 4.0 because it's your language, it's your time, it's your, or you go to a college that is not an Ivy League in the States, it's not as expensive, it goes well, you have good grades, versus the one that gives you a little bit more challenging. It will be great for you, you will learn a lot anywhere, but the truth is that perhaps, maybe I'm wrong, but perhaps it's difficult in some more places than in others, and at the end of the day, they just see numbers. They just see the MCAT and they just see the GPA. They will need to see Once you have those two things, then they evaluate research, volunteering, and leadership. And the other thing is that 60% of the people that is accepted in the UPR School of Medicine comes from Puerto Rico. 30 to 40% only this last year came from the States. So you have more chance to be accepted in the UPR by studying here in Maya West or in the UPR than coming from Harvard or from Yale.
Wow.
I'm telling you about it. When I studied in School of Medicine, I got colleagues that were from Harvard, colleagues from Brown University, from Princeton. None of them were in the top 10. Most of them have to take in the summer preposition courses. And us, first 10 people that were in the first grades, the better grades, the first 10 were all from UPR and Maleos. So what I'm trying to prove the point is that the fact that you're studying here does not by any means make you inferior to the preparation that you receive there.
Oh. No, that's a very common thing we see here is that when they talk about colleges and medicine schools, we tend to look outside of Puerto Rico because maybe we see other opportunities that we don't tend to see here. But as you say, there are big opportunities in Puerto Rico, and we are very well prepared. The Universidad de Puerto Rico really prepares the students, so that's a very important and a very reassuring thing for us high schoolers that we can see that maybe if we don't look outside of Puerto Rico because of the cost of colleges outside are very high, and we don't.
But you can get a scholarship.
Also, yeah.
You can do it. Like Mia is trying to. There are people from Alejandra School, and I bet from your school too, that have received in great places full scholarship. But you really need to analyze the difficulty, and if you're going to be there just for the experience of being by yourself, which is a good experience. You can just do it because you want to be independent and prove yourself, and that's good to know. But other things can be done. You can study here and then go abroad 1 year in Spain or whatever and prove yourself that way. You don't have to prove it the other way. But there are good colleges in the United States that are not as competitive, but are great ones. Doesn't have to be Harvard, and are not as expensive and can give you a good scholarship, and you can do it there and be accepted here. But you know now that it's a little bit harder because the priority is to accept people from here. And in the United States, the School of Medicine raised the bar in terms of the MCAT. So maybe the requirements of the MCATs are higher to get a better score. If you are great on the MCATs, you don't have to choose from Puerto Rico from there. But to study medicine there, they raise the bar. So it's harder to get in the School of Medicine in the States.
I wanted to ask you if you could give us high schoolers any advice for this very long years that are coming for us. What would you tell us?
Well, many things. The first thing is that I really want them to study something that makes them happy, because I see many colleagues that are very aborrecidos because they really don't like what they study. Yeah. It can be medicine, it can be dentistry, it can be law, it can be whatever you want, but please try to know yourself and try to decide whatever you want to choose. Choose in the long run, of course. Try to always see the requirements to reach the goal in the credits that you have to take. Don't decide that in the 5th year or the 4th year. At least try to get the requirements. If you change a law to law or you change to another thing, at least you have the basic requirements, and it will be easier for you to move from one degree to another one. And I remember that when I decided to graduate earlier in the high school, the chemist teacher told me, don't do it, you're not gonna make it. See me, I'm frustrated because I was not able to do it and I failed. I don't want it to happen to you too. And it was very hard for me to get the permit from my teacher because she was the chemist teacher. I needed a recommendation letter from her. And from the principal of my school to try to graduate early. I have to take a lot of AP tests because I skipped a whole year. And if I follow her advice, maybe I will do it anyway, but maybe I won't be able to do it because I will get afraid and I will get frustrated. I think that the other best advice is that whatever you're studying right now, my daughter and some other people say, why I have to study this? I won't use it in my life. Well, wrong. And they are preparing you for what's coming next. Try to use it as your best passport for your future. Try to don't see it as a workload or a study load, because really it will be a wonderful help. If you dominate chemistry today, well, your brother can tell you that. You know that in the bachelor, it will be easier if you just give it a little bit more time in high school. And even in medicine, you're going to take chemistry at OS. So why not dominating now?
That's a great point. We do tend to menospreciar some of the classes that, and I think it all builds to excellence. And if it was made like that, well, it had a purpose for it. So.
And you have a wonderful school. Your school will prepare you very well. Don't get lazy in the path. And my example is that you decide as you go. Really. I really literally decided at the last minute every time. And I did not feel the pressure and I did not feel sad about it. It was just as normal.
What skills do you think we should be building from now on? Where some of my friends, I'm in 10th grade right now, some of my friends are older or younger than me. What skills do you think that we should start building to accomplish these goals that we have right now?
Well, if I am going to tell you that goal directed to medicine, I know nothing about law and I know nothing about being a teacher. I'm not a good teacher. First of all, multitasking. You'll have to learn to do multitasking. Don't think that studying medicine you're going just to do medicine. You have to do so many things in your life. So, like yourself, you dance, you dominate that. When you study, you dominate that. You go to church, you comply with that. You share with your friends. So this is multitasking. Have a trust in your gut, because there's something that is called common sense. And of course, if your common sense goes that way, it's because some reason. And try to be happy with yourself. If there's something that gets you your nights, your sleep, and your worries, that's not for you. About the skills, I think that listening to others is huge. You have to listen. Everyone needs to listen, not to think what you're going to say after, because your patients will be confident to you. Try to understand that the patient is a vulnerable person that is opening your heart to you, so you have to be a very respectful person. So you have to be very respectful of everyone. And how do you practice that? You are a very good example. Every day, good morning. How are you? If a teacher was ill and came back about 1 week, what happened? Anything that I can help you. Even if she won't let you help her, just try to do it. And that's a practice. Whenever you get to your goal of medicine, you are very happy.
Yes, those values really, I see the difference, because I've been to different doctors and we can see the difference in just those values that carry a doctor. For example, with respect and with empathy is a word that I would describe that every doctor should have, because patients enter these doors to looking for help and looking for a cure for what their problem of the time. And I would think that if I would have to apply a value to my everyday life being a doctor, I would be the respect and the empathy for the patients and their emotions as well. not only ours.
If you want to be a surgeon, well, you have to do sports, because having a surgery of 12 hours or 24 hours is not going to happen if you are not fit. So you have to take care of yourself, and you have to have those skills. If you want to be an ophthalmologist, you have to be born with that. You have to be very precise. It's nothing that you can practice. And the stamina that is needed for a surgeon is something that you can also not practice that much. You have to have it.
Be born with it. Yeah, have that talent.
And whenever I rotated in surgery, I knew I was not going to be a fit for a surgeon, because it was very weak for me to do the retractions and to be stand up, and I was always hungry. And I didn't forget it. I cannot keep him alive if I'm hungry. So different specialties have different skill requirements. Those are the most dramatic ones, but the rest you can work on it as you go.
I'm very thankful for the time we have shared, because at least I have learned so much, and I know that every one of you guys has also learned as well from this little meet that we had, and I'm very grateful that I got to learn so much about so many different things, and I am happy that I know that I'm going to be applying to myself, and I'm going to help others as well.
Good luck. But you are great. You are wonderful. You don't need any luck.
But thank you so much for your time. I hope you enjoyed this as well
Of
as
course,
I did.
I love to talk about it. Your family knows about it.
But really, thank you all of you guys for watching today's episode, and thank you to Dr. Sandra Rosario for her time and for being here with us today. So we'll see us in the other episode of Navigating Medicine. Thank you.
Thank you.